Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Ballins.
Hi, Dr. Darrow. How are you today?
Hello, Nita. I'm living it up.
That's good. We want everybody to live it up. I'm living it up, too. So
Good.
Let's talk about what we're going to do here today for the next hour. The program is called Living Pain-Free because we want our listeners to live pain-free. And by the kind of pain we're talking about is basically orthopedics. It's musculoskeletal pain, which could mean pain in your muscles, your joints, your tendons, ligaments, disc pain, back, neck, hip or knee pain, even arthritis pain. And you might have stiffness or dull aches and not know what it's all about. So we invite you to give us a call right here at the station at 866-870-5752. That's 866-870-5752. And when you phone today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And Dr. Darrow is going to talk about what that means in just a minute. It does contain 264 scientific studies on the regenerative treatments that you'll learn about today. You can also go to the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can also watch him performing the treatments on videos. And if you've been listening for a long time, you want to call the office directly. That number is 800-300-9300, 800-300-9300. We are here Saturdays at 10 a.m. and again at 1 p.m., just so you know where you can find us, all over the dial, actually. And one more thing I was going to say is that when we come into a new paradigm, this is regenerative medicine, I want you to be real open-minded and listen carefully because new information is new information. So again, our number is 866-870-5752 right here in the studio with us. Shall we go to Alan in Culver City?
I would love to do that. Alan, this is Dr. Marc Darrow. How are you today?
Hi, Dr. Darrow. I'm okay. I re-injured my left knee about a week ago. I was straddling a chair and I was trying to lift it up because it was broken, and my thigh got all fatigued. And when that fatigue went away, my left knee started to hurt me.
Okay.
And about a week later, my right knee started hurting me also.
All right.
So I'm just, I was wondering how many sessions does it take to heal up my knees?
How many angels dance on the head of a pin? That's a question we don't have an answer to. It's a great question. And the reason for that is some people with terrible maladies get better with one treatment, and other people that have almost nothing going on don't get better at all. So it's always a mystery to me. It's a mystery to me how people are going to do. I can usually give you a pretty good idea after I examine you and see what's going on, but on the radio I certainly can't tell you, and I don't really know what your history is. You said you re-injured your knee, so that means that you had an injury a long time ago. How long ago was your initial injury?
About a year ago, and then it healed up.
Okay. Did you ever go to a doctor and ask what was going on?
Yeah, I went to a doctor, and he took an X-ray, and he gave me a brace to wear. And he said my cartilage I still have cartilage there. And after that, it got better. It seemed to get better after a while.
Okay, so the X-ray doesn't really show you a whole lot. It shows you the bones, and if he said you had cartilage there, that means that he saw a good separation between the bones. If someone has a lot of cartilage loss, when you look at the X-ray, the bones are very close together. But it sounds like he didn't do an MRI or an ultrasound to see what the soft tissue looks like, which is where most injuries... Yeah, that's where most injuries are, in the soft tissue. So I would have to examine you, Alan, and see what's going on. I don't even care.
Do I need to bring in an X-ray or an MRI first? Or?
No, my hands are my MRI. Touching is better than looking at a film. And very often...
You suggest you have stem cells and platelets, or is that the best?
Well, it's the best we have today, but it depends on what is bothering you. Sometimes we'll use PRP alone if it's not a real bad thing, a little tendinosis or something like that. If you've got some arthritis in your knee, we'd probably want to use stem cells and platelets mixed together. But again, all of this I can't dictate or decide on over the radio. It's something I have to put my hands on your knee, move you around, get more history on what's happening, and take a look at it.
Do you draw stem cells from the hip?
No, not the hip. We take it from the back of the pelvis, right above the buttocks, at what's called the PSIS, if you want to look that up. It's the posterior superior iliac spine, and that's a spot that has a good purchase, or a place where we can get a lot of stem cells from. It's very safe. I did a couple yesterday, and they take me about 10 to 15 seconds to do the whole procedure once the area is numbed up. We give a shot of lidocaine first and wait for it to numb up. So it's a very easy procedure to do. I've done... I'm not exactly sure of the number, but I've been doing this for many, many years, and we've got it recorded at about 5,000 of those. And there's other ways to do it also, but a lot of people want to do that way, to use their own stem cells.
Can I get an infection if you draw it from the hip like that?
Anytime someone breaks the skin, you theoretically could get an infection, right?
Mm-hmm.
But it's never happened that I know of. It's never been reported that I know of, other than one case I heard of where it's a very thin needle we put in there. It's not like we're doing surgery. With surgery, opening up the body, there is a high probability of getting infections. I get people that have had post-op infections all the time. And especially if you're in a hospital where they have infections that live there, it's easy to pick them up. But with this procedure, the only one I've ever heard of with all of my doctor buddies who do this is someone who told their patient, like we do, don't go in a hot tub, don't go in a jacuzzi, keep the area dry for a few days. And the woman went into a hot tub that night, and she did get an infection. So what is a hot tub full of? Bacteria.
Bacteria, yeah. Now, if it doesn't work, let's say, can I get a knee replacement?
You can always get a knee replacement, but I don't know why you'd ever want to.
I see.
But doing these procedures of growing tissue using your platelets or stem cells doesn't stop someone from getting a surgery later if they want to. But I'm not going to usually treat somebody if I think they need a surgery. If they need a surgery, I'm going to say go get surgery. It's very rare I have to tell someone that. But there are cases where a joint is so destroyed that I will tell them to do that.
I heard on the radio about like a doctor that does laser guided stem cell replacement or something like that. Have you heard of that?
I don't know what you're talking about specifically. I know there are doctors that do stem cells that will use a laser afterwards to induce more healing, blood flow, and whatnot. It's not necessary to do that. When we do those injections, it pretty much takes care of itself. But yeah, there's a lot of different things doctors try to see what works the best. I don't see the need for it, but if you find someone that you like and he does that or she does that, go for it. It's not any kind of magical thing to add a laser to stem cells. It may look good on the advertising.
Yeah. What do the stem cells do? Do they like tighten up the area, or how does it work? Like,
well, anything we use to proliferate new tissue, back in the old days, because I've been doing this way over 20 years, we had sugar water we injected, or sodium moreuate, or zinc sulfate. These were irritants, and they would create an inflammatory response. And they would bring fibroblasts to the area which grew collagen. When you were a little baby, your fibroblasts were very active and overly stimulated, well, actually not overly, but very stimulated, to make you a bigger person and to grow your bones and tissue. So we don't do that very much anymore. I still do it once in a while, but I don't like to because it's not very effective. We have much more advanced treatments like platelets and then stem cells. So what's happening? We're just growing tissue. We're proliferating or stimulating new tissue to grow. So if you have an injury like you have, and yours is not very bad, thank goodness, but any type of thing where we want to stimulate more tissue growth, where people have arthritis or meniscal tears, rotator cuff tears, I inject the whole body. You know, I don't just do knees or shoulders. There's no place on the body in the musculoskeletal system probably that I have not injected over all these years. Everything from, the top of the head all the way down for neck and back pain, down the legs and arms and down to the bottom of the feet. So this stuff can work anywhere if used appropriately. You have to pick the right patient. You can't just inject anything and think you're going to get rid of someone's pain.
Mm-hmm. Can the knee heal on its own? Or
yes,
no?
It can. Any part of the body can heal on its own. Any injury you have creates inflammation, and inflammation brings fibroblasts to the area, which are cells that grow back the tissue. That doesn't mean it will heal.
Yeah.
Most injuries that we have do heal by themselves. I have probably, being an athlete, I was a gymnast when I was young, which is a very ballistic sport, and I had injuries every single day. There wasn't a day that I didn't walk out of the gym with something that hurt. But most of those, 99% of them, went away. But there are lingering things that don't go away, and there are people I've had come in with 50 years of back pain that we've healed with one treatment.
Wow.
And then there's other people that have newer injuries, and we have to do lots of treatments, and they still don't heal. That's why I say it's pretty magical to me how it all works. We know the science on it, but we don't know the timing of it. And when you said something before about if you do a treatment and it doesn't work, can you get surgery? Well, it's working. It just hasn't had the effect where you feel better yet. And most people that don't heal because they didn't do enough treatments, or they've overused that area again. So I just got an email this morning from a gentleman from Mexico who flew up to get his knee injected, and that was 2 weeks ago. And he's complaining in his email that he wants to play tennis and ride a bike, a unicycle, and do some other things right now. And I wrote back and I said, well, you can do that, but it's not going to give the tissue a good chance to grow back. It's going to irritate it.
I see.
So, in healing, we have to be a little bit patient and let things heal.
Mm-hmm. Mm-hmm. And you probably have to you should just do like walking or take it easy.
Well, it's good to take it easy for a while, yeah. Let it heal up.
Yeah. Okay, well, thank you. I'm going to give you a call.
All right, Alan, the phone number to my office is 800-300-9300. I'll repeat it for everybody else. It's 800-300-9300. And you can go right now to the website, which is www.lastemcells.com. I'll repeat it for you, www.lastemcells.com. There are videos there of me doing these procedures, and you can watch and see if you think it's something you want to do. And for all you other folks who want to call in and speak to me right now, the number to the studio is 866-870-5752. That's 866-870-5752. I'd love to talk to you. Alan, it's been great talking to you. God bless you. And there's good hope for healing your knees. Yours should be easy. No promises, but should be.
Thank you.
Thank you for your call, Ellen. We appreciate all your calls today here right at the station. 866-870-5752. That's 866-870-5752. And you get the free book, Dr. Darrow's latest. It's called Stem Cell and Platelet Therapy. Regenerate, Don't Operate. It has 264 studies, and the foreword is written by Suzanne Summers. And we have something else going on in your office. Do you want to talk about that for a minute? Or do you want to pick up Greg?
Well, we got a lot of things going on. No, Greg can hang. You can hang for a second,
Okay, hold on, Greg.
We do vampire facelifts, which is similar to what I do. It's stimulating tissue to grow instead of where I do it on the musculoskeletal system into the face. And it makes the face look very young, very quick. It regrows the collagen. As we get older, the collagen all over the body dries out. And then we do hair regrowth on the top of the head with the same treatments. We can use platelets or stem cells on the top of the head. So, Greg, we're waiting for you. Your wife has problems with her knees. How are you today, Greg?
Yeah, good. She has a problem with her left knee. So I'm just wondering, when she works out, she has some pain there. So would that be appropriate?
Yeah, probably very appropriate, because the fact is you already said she works out, meaning she probably has a really good knee, and there's just probably something in it that's been tweaked. And that happens to a lot of people, and it's usually pretty easy to fix. Has she been to a doctor about it?
A couple of years ago, but she always complains about it, so I should have her give you a buzz and then maybe go see you. Definitely.
Yeah, that'd be wonderful. The phone number to the office is 800-300-9300. I'd love to talk to her. Is she sitting around right now?
No, she's not with me. I'm just in the car. Maybe you can have your assistant email me or just text me all your info, and then I'll get it done.
We'll give you a call a little later. Yeah, no problem.
Right. I appreciate it. Thank you.
Yeah, thank you.
Thank you.
Thanks for your call. Our number is 866-870-5752, right here at the station. The website again is www.lastemcells.com. That's www.lastemcells.com. And the office, excuse me, wow, allergies. The office is 800-300-9300. That's 800-300-9300. You can call 24/7, and if someone doesn't answer, your call will be returned very promptly.
I think it's funny that you coughed and said it's allergies. No one wants to cop to anything else today.
Well, it really is allergies, and
I know it is.
I mean, I know you 16 years, so I know you know me. So, but yeah, if I was sick, I wouldn't be here.
I've got a question here from a nice person.
Oh, good.
And by the way, I get questions all day, all night long from the website, which is www.lastemcells.com. Every page has a spot to email me. So this person says, I was just diagnosed with a torn rotator cuff. Will your treatment help enough to avoid surgery? The answer is most likely yes. I haven't examined this person yet to see what's going on. But the rotator cuff is a series of 4 tendons that come from 4 muscles that hold the humerus bone, that's the arm bone, in place in what's called the glenoid, or the glenohumeral joint. So I have at least 2 rotator cuff tears in my right shoulder, and I have a labral tear in my right shoulder. Does that stop me from any sports? No. Why? I injected it with stem cells. It did hurt before. It was actually locked up where I couldn't lift my arm. But I healed myself. I self-injected myself. I used stem cells and platelets. And I'm good to go. So the fact that I have torn rotator cuff tendons means nothing. I'm going to bet just about everybody on the planet who's active when they get into what we'll call middle age has rotator cuff tears. It's just kind of like normal with activity. It's like when you're driving a car, the tires kind of wear down, right? You don't look at it and go, oh, I need a new tire, meaning I don't need to get surgery. So way too many people get surgery when they don't need it. When I was studying surgery in medical school and preparing to become a surgeon, I thought, and we all thought, surgery was the only way to get rid of pain. Today, it's the opposite. We don't like to send people to surgery. I can't remember the last time I sent any of my patients to surgery. I honestly can't remember if and when. I know years ago maybe I did. But using platelets and stem cells is the new way to heal in the musculoskeletal system. Unfortunately, it's not going to become mainstream medicine until the old docs who do the surgery quit their practice, one way or another, whatever that means for them. But I've been teaching this at UCLA for the last 20 years, and other doctors are teaching at other major teaching universities and med schools, and there are more and more doctors who are doing regenerative medicine. It will be the new medicine. It is for my patients, and it is for many, many, many other doctors' patients, but the orthopedic surgeons still tell their patients it cannot work, you cannot grow tissue, and that is false. We have studies and studies and studies showing tissue growth, and we have studies and studies and studies. We do them in our office. We have a 25-person research team. They're all students or postgrads trying to get into medical school, and the research helps them. So they volunteer and they do research with us. And we have amazing success. And so the answer to this question is, can you avoid surgery? In most cases, you can. I'm not going to promise anybody anything, and certainly the surgeons shouldn't promise anything either, because I get patients all the time who said the surgeon said I'll be fine afterwards, and they got worse. Who's one of those, Nita? Do you remember?
Well, yeah, my colleague Terrence McNally.
Oh, yeah, I forgot about him.
In another media outlet was one, and he had one knee in very bad shape, and the other knee was on its way out. But we'll have to continue that story when we come right back from our break here on Living Pain Free with Dr. Marc Darrow. Grab a pen or pencil.
Stick with us, folks.
Stay with us. Grab a pen. Write down this information. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.